Genetics and how diabetes comes from family. Imagine your genes are like instruction books for building your body. Some instructions, like eye color, are passed down from your parents like a family recipe. There are about 7 genes involved in diabetes. The lifetime risk of developing type 2 diabetes is about 40% for individuals who have one parent with type 2 diabetes. But it increases to about 70% if both parents are affected by diabetes. Even if diabetes is in your family, you can delay or prevent type 2 diabetes by changing to a healthy lifestyle and eating pattern. There are about 7 genes associated with type 2 diabetes risk. TCF7L2 affects insulin secretion and glucose production. ABCC8 regulates insulin. CAPN10 related to type 2 diabetes risk in Mexican and Mexican Americans. GLUT2 assists in moving glucose into the pancreas. GCGR related to glucagon hormone, which is involved in glucose regulation. Exploring the genetic basis of diabetes and unraveling the familial connection. Genetics plays an important role in shaping our health outcomes, and one of the conditions where its influence is particularly significant is diabetes. Diabetes mellitus, a chronic metabolic disorder characterized by elevated blood glucose levels, has been increasingly recognized as having a strong familial component. This video delves into the intricate interplay between genetics and diabetes, shedding light on how family history can contribute to the risk and development of this prevalent health condition. Genetic basis of diabetes. Diabetes includes a group of disorders, with the 2 primary types being type 1 and type 2 diabetes. While both types involve disruptions in glucose metabolism, they differ in their underlying genetic factors. Type 1 diabetes. It is believed type 1 and type 2 are different, but even type 2 people can reach a stage similar to type 1 where their insulin production drops to a level equal to or even less than type 1 diabetes person. That could be due to damage to insulin-producing beta cell damage in type 2 as well, similar to type 1. I have experienced this myself as my insulin production has reduced. Type 1 diabetes is primarily an autoimmune disorder where the body's immune system mistakenly attacks and destroys the insulin-producing beta cells in the pancreas. Genetic susceptibility is a crucial factor, as individuals with a family history of type 1 diabetes have an increased risk of developing the condition. Specific genetic markers, such as certain human leukocyte antigen, HLA, genes, have been identified as associated with the predisposition to type 1 diabetes. Type 2 diabetes, which accounts for the majority of diabetes cases, is characterized by insulin resistance and impaired insulin secretion. Familial aggregation is a well-established phenomenon, with individuals having a family history of type 2 diabetes exhibiting a higher risk of developing the condition. Multiple genetic variants, often interacting with environmental factors like diet and lifestyle, contribute to the risk of type 2 diabetes. These include variants in genes related to insulin sensitivity, beta cell function, and glucose metabolism. While we are in the middle of the video, do not forget to hit the like button. See the description and comments for references. We would appreciate your comments. Heritability and genetics of type 2 diabetes. Research has unequivocally established a strong genetic component in the development of type 2 diabetes. Individuals with a family history of the condition face an elevated risk compared to those without such familial ties. Specific genetic markers associated with insulin resistance, beta cell function, and glucose metabolism contribute to an increased susceptibility to type 2 diabetes. Understanding these markers can shed light on an individual's genetic predisposition. Section 2, Family History and Risk Assessment. First-degree relatives. Having a parent or sibling with type 2 diabetes significantly raises one's risk. The risk amplifies further when both parents are affected, indicating a potent genetic influence. Inheritance patterns. While genetics plays a pivotal role, the inheritance of type 2 diabetes is complex, involving a combination of genetic and environmental factors. Section 3, Actionable Strategies for Prevention. Adopting a healthy lifestyle is a cornerstone in the prevention of type 2 diabetes. Emphasizing regular physical activity and a balanced diet helps mitigate the genetic risk. Individuals with a family history should undergo regular health checkups, including blood glucose monitoring and lipid profile assessments, for early detection. Seeking genetic counseling provides individuals with insights into their specific genetic risk. Armed with this knowledge, individuals can make informed decisions regarding lifestyle changes and preventive measures. Pharmacogenomics and precision medicine. Advances in pharmacogenomics allow for tailored medical interventions based on an individual's genetic profile. In summary, the journey to unravel the genetic tapestry of type 2 diabetes, recognizing the influence of family history, is pivotal. This 6-minute video underscores the importance of genetic factors in diabetes, particularly type 2, and provides practical steps for individuals with a familial predisposition. By embracing proactive lifestyle changes, regular health monitoring, and leveraging advancements in genetic understanding, individuals can empower themselves to break the familial link to type 2 diabetes and pave the way for a healthier future. Do not forget to click the like button. Thanks very much for watching this video. Up above you see 2 videos related to health. It will be more helpful to you and your family. See you in the next video.